This chapter is on the appendicular skeleton. The appendicular skeleton is going to include the bones of the limbs and the girdles of the bones that attach those limbs to the axial skeleton. So it begins with the pectoral girdle, which holds the upper limbs in place. And the pectoral girdle is made up of the scapula as well as the clavicle. The pelvic girdle is made up of what's called the os coxa bone, and that bone is a fused bone with the ilium, the ischium, and then finally the pubis. So this image is showing you the main bones of the appendicular skeleton. The appendicular skeleton is a total of 126 bones. So we have the 126 bones from the appendicular skeleton, the 80 bones of the axial skeleton for a grand total of 206 bones. So here we see the pectoral girdle of the clavicle and the scapula. Attached to the clavicle and scapula would be the upper limb, which is the humerus, the ulna and the radius, the carpals, metacarpals, and phalanges. And again, the bulk of these bones are going to be the long bones in the hand, which would be the metacarpals and the phalanges, as well as in the foot, which would include the metatarsals, as well as the phalanges. The pectoral girdle is the hip bone, and it comprises three different bones, which are all in the coxal bone. Hanging off of the pelvic girdle is the thigh bone, which is the femur, the knee bone, the patella, and the fibula, the tibia, and then the ankle bones are collectively called the tarsals. So the pectoral girdle articulates with the trunk, and it also supports the upper limb. So it's kind of the connection between the axial and appendicular skeleton, but it's the first part of the appendicular skeleton for the upper limb. Consists of the clavicle and the scapula. It has attachment sites for both muscles that move the arm, promotes upper limb mobility. So the scapula moves across the thorax and the arm moves with it. And this shoulder joint has a shallow cavity, which is going to allow more movement but less stability than the hip joint. So there is more movement. So if you think about the type of movement that a pitcher has, for example, but also less stability compared to the hip joint. So the hip joint, for example, is not going to be as damaged or damages easily as the shoulder joint. When we look a little closer at the clavicle, we see that it's an S-shaped bone. It extends from the manubrium of the sternum to the acromion of the scapula. And the acromion is the highest point of the shoulder. It's a body region that you learned earlier on in the semester. So the acromion would be on the lateral end of the clavicle, and the sternal end would be on the medial end of the clavicle. So the sternal end articulates medially with the manubrium of the sternum, and the acromial end articulates laterally with the acromion of the scapula. When we look at this image, it's showing the combination of the clavicle plus the scapula forming the pectoral girdle. So we can see on the medial end is the sternum. The acromion is going to be on the lateral end of the clavicle, and it articulates or forms a joint with the acromion process on the scapula, as you can see on this x-ray on the right-hand side of your slide. Another important part of the scapula that you should know is called the glenoid cavity, also sometimes called the glenoid fossa, and we also see the clavicle. Our next slide is showing the scapula, which has three borders to it, but it's important that you know and can identify the glenoid cavity. That's a point of articulation with the head of the humerus. There's also a ridge of the scapula that you can touch from the posterior side of the scapula called the scapular spine. The lateral portion of it is called the acromion process. So we see a view of the scapula here, a diagram on the left showing the acromion, the glenoid cavity, the various angles of it. So again, it's important that you can identify the acromion, the spine. And then on the image to the right here, we have an articulated skeleton. And this is identifying the acromion specifically. So you should be able to identify it on a diagram like this. The upper limb is a total of 30 bones, and it begins in the brachial region with the humerus. Then in the antebrachial region, which we remember is the forearm, that includes the radius and the ulna. When you're standing in correct anatomical position, the ulna and radius are going to be parallel to each other, and the radius is on the lateral side. There are 8 carpal bones, which are short bones, 5 metacarpal bones in the palm, and finally 14 phalanges, because we have 3 phalanges in digits 2 through 5 and 2 phalanges in the thumb. The humerus here, some of the important parts to identify of it are the head, which articulates with the glenoid cavity of the scapula, the greater and lesser tubercles. So the greater tubercle is located a little more proximally than the lesser tubercle is. The shaft, which is where that diaphysis is of the long bone, has a tuberosity called the deltoid tuberosity. And that is, of course, an attachment for the deltoid muscle. Condyles that are at the distal end of the humerus include the capitulum, which is a lateral projection. And so that you can identify at the bottom of the slide. On the medial side, there's another projection which articulates with the ulna called the trochlea, which sort of comes to a bit of a point here, as you can see on the slide where the highlighter is. There's also another important portion on the posterior surface of the humerus called an olecranon fossa. You remember learning that a fossa is a slight depression, and it forms a joint with the olecranon of the ulna. We can also see the epicondyles, the lateral epicondyle and the medial epicondyles. So the condyles themselves actually have these specific names. So the lateral condyle is actually called the capitulum, and the medial condyle is called the trochlea. So at the elbow joint, we can see some of these parts of the humerus. We see the lateral epicondyle, medial epicondyle. If we look at a posterior view, we can see the epicondyles as well as the capitulum trochlea, and then also the olecranon of the ulna that articulates in a depression called the olecranon fossa, which is located on the humerus.